Hi YouTube. So here's 4 things that I'm personally doing to reduce my risk of having a total hip replacement surgery, or at least maybe delay the inevitable. So the 4 things are, I'm going to really refocus my time in the gym. I'm going to take a look at my nutrition and my diet habits. I'm going to take a look at how much water I'm drinking, and I'm going to kind of rethink my cardio activity. So if you're new to the channel, just a little bit of background. My name is Darwin. I am a physical therapist and I'm in my mid-age, my midlife. I just recently turned 51 years old, so I'm getting older. I have arthritis in both of my hips and it pains me. Some days are better than others. Some days it hurts getting up and down the stairs, getting out of bed. Other days it feels real good. I'm someone who has been very, very active my entire life. So I've got a lot of miles on my hips, I always say. And, being 51, it sounds pretty young to be considering a joint replacement. And I'm not there yet, by the way. Um, but it's not. There's some of you who are watching are probably in your midlife and experiencing some pain in your joints, maybe your knees, maybe your hips, and are starting kind of down this path. But just know that there are specific things that you can do to reduce the pain. I don't think you're ever going to get rid of the arthritis altogether, but you can do things to reduce the inflammation that comes with the arthritis and make you feel better and make you get through your day a lot better. And actually, really thrive, not just maintain a level, but actually get better in your activity levels. So, like I said, I was very active. I've run a number of marathons. I used to do triathlons, and I've done one Ironman over my life. So, these hips do have a whole lot of miles on it. So, the fact that it's got arthritis is not alarming or shocking to me. For anyone out there, this is not a sentence of immobility, but it's something that you need to address. So the first thing I mentioned is kind of taking stock into my gym routine or a restock. I go to the gym, 4 or 5 times a week. I do heavy weight lifting, at least 3 days a week. That involves usually one pulling day, one pushing day, and one day for legs. And when I say pulling, that means all the activities, all the weightlifting where you're pulling in close to your body. So that means you're going to be hitting your your lats, kind of your interscapular muscles, your rhomboids, your mid traps. Um, I do my biceps on those days. And then when we're doing a pushing day, that's going to be a lot of chest and shoulders and tricep centric work. And then legs, I just do, all my body parts, my hamstrings, my glutes, my quads, my calves, adductors, abductors, all those things. I try to get a full kind of complement of all the legs. So I found that this gym routine has been fairly effective for me. 3 days of specific body part strength training, and then one day, if I have an extra day, I kind of just do a full body strength training workout, which is all fine. I don't want to deviate too much from that. But what I am going to change starting today, actually, is I'm going to spend at least 4 days a week doing a 10-minute kind of preventative physical therapy treatment for myself. So now the clinician becomes the patient. I'm going to set myself up just like any of my clients that I do. I'm going to devise a workout, a physical therapy plan for myself that'll take no more than 10 minutes. And I'm going to make sure that I'm a compliant patient, like all my patients are, I'm sure. And I'm going to knock this out for 10 minutes at least 4 times a week. It's also something that I will be able to do at home. So there's no excuse if I'm traveling or if I'm not able to get to the gym, I can spare 10 minutes. I'll spend a whole other video probably showing exactly what I'm going to be doing for my preventative or rehab for my hips. But generally, it's going to be a lot of glute strengthening exercises, a lot of gluteus medius, which is on kind of the outside here of the hips. Some mobility work. I've found that if I really try to push into gaining a lot of mobility in my hips, it really doesn't go very well for me. So a lot of intermediate aggressive yoga has not worked for me. So I'm going to be very gentle with my mobility exercises, but I know I can certainly get more mobility if I work at it. So that's the first thing I'm going to change. I'm going to actually do a dedicated physical therapy treatment, which I know I should be doing as a physical therapist. So I'm going to do that. And this is kind of documenting this is one way to hopefully keep me honest and keep me very accountable to whoever's watching that I'm actually doing my physical therapy treatments. Okay. The next thing I'm going to be doing is taking a look at my diet and nutrition. Now, I don't have a lot to change in this regard. My diet and nutrition is pretty good. We live here in Mexico, and I find that the food is just a lot fresher and healthier here. You know, we buy a lot of our fruits and vegetables just off roadside stands, so it comes kind of right off the farms. So we eat a lot of, very healthy organic fruits and veggies. And I do try to get a lot of protein. I'm not quite to the point where I'm getting 1 gram of protein for every pound of body weight, but I'm getting about, 120, probably about 100 to 120 grams of protein every day. And so that part of my diet with the high protein and organic kind of fruits and vegetables, I'm really fine with. Other things that you can do to really, if you're looking at your diet, is stay away from inflammatory type of food. So that means processed foods. That means fried foods. Things that come in boxes typically aren't the healthiest for you. Those are things you can do. Personally, we've kind of cut most of that out. We'll have a pizza every now and then, but for the most part, our diet's pretty good. The other thing, though, that I will modify in my diet is just dialing back on the amount of alcohol. Alcohol is another inflammatory food or drink. And so I am going to test this and see if I take note that I have less pain in my hips if I'm not drinking as much during the week. So we'll see. Again, just another simple change that I need to change anyway. I like drinking martinis an awful lot, but maybe I just reserve them for weekends from now on. So that's the aspect of my diet that I'm going to just cut back on, reduce the amount of alcohol that I'm drinking, and let's see if that has any effect on the pain that I'm feeling in my hips. The third thing I'm doing is taking a look at my water consumption. Now, you'll read all different types of things in the literature about how much water someone should be drinking. And it fluctuates, and it should, based on your age, based on your activity level, based on the environment that you live in. Again, we're in hot, humid Mexico, so that's going to bring our levels up anyway. Right now, I'm shooting for 12 glasses of water a day, 12 to 16 if I'm having a highly active day. Take that a little bit higher. And I'm pretty good about that. But, some days I just don't get there. So starting today, I am going to just maintain consistently and get at least 12 cups of water every single day. Now, there's a couple tricks that I figured out that helps me get going is when I come downstairs first thing in the morning before I get any coffee is I just knock out 2 cups of really cold sparkling water. So I start out, before 6 a.m. I've already got 2 cups of cold water. It's a great way to get my day going, and I'm already, 1/6 of the way to my goal for the day. So that's helped me quite a bit. The other thing that I'm doing is sometimes water can get kind of dull and boring. So sometimes I'll squeeze half a lime into the water, put a little salt in there for some electrolytes. And that helps kind of get me motivated to continue drinking throughout the day. Now, what does water consumption have to do with arthritis? Well, what it does is it actually can help the synovial fluid or the fluid in the capsule to stay hydrated. Obviously, if you're drinking a lot of water, that's going to flow through your body system. And you really want that fluid in the capsule to maintain hydration, to maintain its viscosity. So it lubricates the joints. So the more lubrication there is in the joints, the less of that kind of bone on bone arthritic changes is going to cause a problem. So physical therapy treatment. reduced inflammatory foods, increased amount of water consumption. And the last thing I'm doing is taking a look at my cardio workout program. So again, I used to do a whole lot of running. I love to run, but it's not feasible. I try every now and then to go out and do a light jog and end up kind of flaring myself up. I'm not giving it up altogether. I still think there is hope if I stay consistent with this routine. I do want to get out there and start jogging again. No more marathons, probably no more half marathons. And I think I'm fine with that. I think I've scratched that itch enough. But I would like to be able to run a 5K or so without increasing the pain. So I'm getting 10,000 steps a day, or I'm shooting for 10,000 steps a day. It's low impact. It's just kind of walking around. Being in nature is a good thing for the mind as well. But I'm going to go back to doing some stationary bike riding and really getting in the pool and doing some more swimming, which I used to, begrudgingly do for training for triathlons. I need to embrace it a little bit more and try to get some cardio going in the pool that's obviously non-impact for my hips, and try to get some cardio going that way as well. I've been trying the stationary bike and recumbent bike last couple weeks. That's actually been causing some pain as I go through a full revolution. When I get that hip flexion up to 90 degrees or a little bit more, it's causing some pain. So I'm hoping that as I start to be more consistent with the physical therapy treatment, that at least I can tolerate getting back on the bike and getting some cardio that way, in addition to swimming in the pool and my 10K steps a day. And then we'll see if, maybe in a few weeks, if I feel like running, I will give it a go and see what happens. So as a physical therapist, these are the 4 things that I'm doing. Feel free to tag along if you want. If you want any help or support, any suggestions you need from me, drop a comment below. And thanks for being along on the ride. And I hope to be accountable to you guys. Take care.